Hello, everyone, and welcome to Functional Fertility, the podcast designed to demystify your hormones, up-level your lifestyle, and supercharge your fertility potential. I'm your host, Dr. Kalea Wattles, and today's episode is all about body literacy and empowerment with the fertility awareness queen herself, Lisa Hendrickson-Jack. Lisa is a certified fertility awareness educator and holistic reproductive health practitioner who teaches women to chart their menstrual cycles for natural birth control, conception, and monitoring overall health. She is the author of 3 best-selling books, The Fifth Vital Sign, a favorite of mine, the Fertility Awareness Mastery Charting Workbook, and her most recent book, Real Food for Fertility, which she co-authored with registered dietitian nutritionist Lily Nichols, who was also on our show recently. Lisa works tirelessly to debunk the myth that regular ovulation is only important when you want children by recognizing the menstrual cycle as a vital sign. With well over 4 million downloads, her podcast, Fertility Friday, is the #1 source for information about fertility awareness and menstrual cycle health. It's such a treat to have her with us. Welcome to the show, Lisa.
Thanks so much for having me.
Well, I think we should just take this one right at the beginning because I think many of my listeners are somewhat familiar with fertility awareness, but I believe there's many misconceptions about what that means, or maybe some confusion. Like, is it just putting my menstrual cycle in an app? Is it taking my basal body temperature? Will you just take us all the way back to square one and tell everyone, what is fertility awareness?
For sure. Great question. I mean, fertility awareness, I think there's different ways of looking at it. I think you can look at it in a general sense, which would mean having an awareness and general understanding of your menstrual cycle. So knowing some of the basic tenets, like you're not fertile every single day, and that you can actually identify when you're fertile in your cycle, you can pinpoint ovulation, and you can even predict your period. So I think in a general sense, fertility awareness can mean that having enough of an understanding about your cycle and your body that you just know how it works. And this is definitely one of those things where you hear when women do fall down the rabbit hole of fertility awareness, they always say, no one ever taught me that. So just those basic things about our cycle, we don't even know, but we can go down the rabbit hole with fertility awareness and take it to another level. Because when you do learn to track your cycle, track your main fertile signs, typically your cervical fluid, basal body temperature, cervical position is optional, you can actually use it as a method of birth control. So the symptothermal method of birth control has been shown to have an efficacy upwards of 99.4%, which puts it right there with other, hormonal methods. And many women don't know that, they've never heard of it, or they think it's your grandmother's rhythm method, so to speak.
Yes.
But there is evidence, scientific peer-reviewed papers on the efficacy, and there's different methods of fertility awareness charting that can yield this level of efficacy. And for women who are trying to conceive, there's also that aspect of it where you can learn to chart your cycle, determine which days are optimal for conception. A lot of women stumble on this material when they're trying to conceive after being told that they could get pregnant on every day of the cycle, and then they're trying and it's not happening, only to discover that there's this whole other side of the story where there's actually only, from a scientific standpoint, 6 days of the menstrual cycle where pregnancy is possible. So there's a whole lot to delve into there.
There's a whole lot to delve into. And I've told this story before, but I think there's a perfect example here. I had a patient and I was working with her on her fertility. She was had been trying to conceive for, I think, about 9 months or so. And she comes into my office. She's 32 years old. And I introduced this concept of cervical mucus. She has never been told about this before. It is blowing her mind. I leave the room to go print out her treatment plan. I come back and she said, I just put everything you told me in the group chat to my best friends. There's 5 of us on there. We're all in our 30s. None of us knew about this before. And it was a funny and cute and lighthearted example. But really, I walked away realizing how we're done a disservice. No one teaches us about this. Our moms aren't teaching us about it. We're not learning it in school. I mean, like you said, really many of us come to this information because we're Googling, because we're stressed out and we're trying to conceive. And it's almost like a defense mechanism is what draws us to this information. So I'm so glad that you've definitely done your part spreading the word, and you've pioneered this concept of the menstrual cycle as a vital sign and using our menstrual cycle as a diagnostic tool. Will you tell us a little bit more about that concept of the menstrual cycle as a vital sign that we would care about just as we care about someone's blood pressure or their temperature?
Absolutely. And I wish I could take credit for creating that, but I didn't. I'm just the mouthpiece on that. Interestingly, there are medical bodies who are looking to incorporate that. And interestingly, there were a couple of studies like ACOG put out something specific, and I think that often they're looking at it in the context of teenagers. And so that was the context of that piece where they were saying we should use the menstrual cycle as a vital sign in teenage girls, because obviously, if you have a teenage girl who's, say, 16 years old and she hasn't had her first period, given that the average age is about 13, that would indicate that we should be looking into that. And so it was encouraging doctors to start asking about these, the menstrual cycle and these questions. I would say they didn't go far enough because I think it's obviously very important to do that in teenage girls, but I would argue that it's also important to do of women of reproductive age in general. And so I simply, this was part of my personal experience when I discovered fertility awareness. I took a class with a group of women in my 20s, and through the Justice program, and that was one of the things that they were teaching at that time as well. So um, we really need to start looking at our menstrual cycle as more than just, it's only important when we're trying to have babies. So going back to the piece about the menstrual cycle as a vital sign, if you think about, the vital signs that we're most familiar with, which would be things like our body temperature or our respiratory rate, our blood pressure, those types of things. When you go to the doctor, they're going to measure, but they have a normal range that they're looking at. So if you're out of that normal range, not only does it tell them that there's something wrong in general, but if your blood pressure is too high or your temperature is too low, it also gives a kind of a short list of symptoms for them to look deeper into of what it could be. So it kind of gives a flag in that respect. And our menstrual cycle can be much the same way. And we can really go into the weeds with the menstrual cycle because it's not just one characteristic we can look at. We can break down the period and look at, how many days you're menstruating, how much bleeding you're having, how much pain you're having. We could look at all of those factors. We could look at the overall menstrual cycle length from the start of your first period to the start of the next one. We can look at when ovulation is happening in the cycle. We can look at your cervical fluid patterns and see if they're normal or abnormal. The luteal phase length, which is the period of time between ovulation and your next period. So we can actually break it down because there's a number of different factors that could play a role. And it could be something as simple as you're showing, quote, discharge every single day when we know that you're supposed to have your, cervical fluid during that pre-ovulatory phase. And that could be a sign of a yeast infection. Or it could be something like you haven't had a period in 6 months, and that could indicate that you might be dealing with something like hypothalamic amenorrhea, which is usually associated with overexercise or undereating or a combination. And, women who go an extended period of time without having a menstrual cycle are at a greater risk of developing osteoporosis. So what's interesting is that there are these connections between our cycle and our overall health. I'm of course happy to be the mouthpiece on that so that we can start talking about it. And I believe it is something we should be learning about in school and things like that. I remember learning about the ears, like the what they call it, like the anvil or like all those little bones in there. And I mean,
Yes.
that
Yep.
was like useful and interesting, but that doesn't help me to build my family. I think the thing that helps you to, have your children is probably more important to learn about, I would say.
I mean, makes sense to me. And then I've never had anyone come in and say, you know what? I couldn't remember those bones in the ear and it really cramped my style.
It really
Where we
affected my
don't know
life in a
about our
negative way.
cycle. Yeah. So you mentioned that if we're diligent and we're tracking our cycle, that we may be able to pick up on some abnormalities that would help us to maybe prompt us to seek care and talk to our doc, have a deeper understanding of what's going on. A question that's come up to me before is, so you mentioned, maybe long cycles that might help us screen for things like hypothalamic amenorrhea or PCOS. What about something like endometriosis? Are we going to see any signs or clues in our cycle tracking that maybe we should talk to our doc about the possibility of endo?
I mean, it's such a great question. Endo is unfortunately really common. It shows up in different ways. So I think for a lot of women, it's the presence of pelvic pain and pelvic pain outside of when you would expect to, not that. So to kind of, we could talk a little bit about pain in general. I mean, pain with menstruation is extremely common. And a high percentage of women do experience pain with menstruation. Unfortunately, that pain is normalized. So a lot of women think that it's normal. And I'm sure you found this in your practice, but I found that I have to specifically ask for it. I kind of have to dig for it. I have to get women to kind of rate their pain, and I have to make a point of asking about it. If I don't, then they won't say anything about it because we're so programmed to think that it's normal. So I think one piece of that conversation is starting to understand that when we look at the menstrual cycle as a vital sign, we do want to recognize that we can determine and define what those normal parameters being, including pain. And I would argue that, moderate to severe pain we should be looking at, not because it's uncommon, because it's extremely common, but because, one way to put it out there is imagine if there was a man in your life, like pick a man, partner, brother, friend, father, who had extreme pain in his penis for a couple of days every month, right? No one would think that's okay, but for some reason in our culture, we just think that it's completely fine. So at the most basic level, before we even get to the conversation about endometriosis, moderate to severe pain with menstruation can be a sign of inflammation. It's a sign that something is awry. Something's going. So we don't have to go all the way to that, but we just first of all need to acknowledge that pain could be a sign of a problem. Now, when we get into the extreme pain that isn't responding to medication, pain that, even if you have to take special medication for, or pain that maybe you're put on the birth control pill for the pain, which is one of the common things that are done, and that doesn't really touch it. So we do want to look at when the pain is more extreme. There's other signs related to pain, pain that occurs outside of your period, as I had mentioned. So when you're having pain mid-cycle, when you're having pain for several days before your period even starts, that's something to be watching out for. Also, pain with sex. I think that's a really big kind of flag to watch out for when you're having pain with sex. And if you're tracking your cycle, that could give you an opportunity to even identify when it's happening. Because a lot of women experience a lot of things, but if they're not tracking their cycle, they would never even think that there could be a link between when they're experiencing the pain and where they are in their cycle. And so just that information can be really helpful. But I would say knowing some of those factors, also abnormal bleeding, I think it's important to kind of keep that in mind, where the period should be like a sentence. It should have a beginning, a middle, and an end, and then it should be over. So if we are seeing having a little bit of spotting around ovulation once in a blue moon isn't necessarily something we need to be really concerned about. It can be related to the sharp rise in estrogen and, around that time. But if you are seeing bleeding, spotting that's happening mid-cycle throughout the cycle regularly, we should really be looking at that. So in terms of endometriosis, I would say those are some things to really pay attention to. But on the flip side, endometriosis is a really complex condition that's characterized by, tissue that's growing, uterine tissue that's growing outside of uterus in different areas of the body. And what that means is that some women can have really severe endometriosis with no symptoms, with no pain, and maybe their symptom is infertility. And so that's something to be aware of as well, where many women with endometriosis experience severe pain symptoms, a variety, because the symptoms can vary so greatly because the tissue can be almost anywhere. I interviewed a woman on my podcast who had endometrial tissue in her peritoneal cavity, and it was causing her to have like completely different symptoms. Like it was connected to her cycle. So she noticed these symptoms as her period would approach, but she would have difficulty breathing and things like that, which is not typical of endo. So I feel like I've opened a can of worms, but I think on the most basic level, we should be paying attention to pain, and we should be tracking some of these abnormal symptoms that we're experiencing to see if they're cyclical, to see if there could be a hormonal component.
Yes, beautifully said. And my takeaway from listening is when we're tracking or when we have cycle awareness, it's not only, my period started this day and then day one of the next month was this day. It's also paying attention to pain, or I'll have patients pay attention to their bowel habits and see how that changes throughout the mood, all kinds of different aspects that can help us to build these connections between our symptoms that we're experiencing, what might be happening with us hormonally, and is there a pattern to it? And I think that's super empowering. Endometriosis, like you said, there's many different signs that we could look for, but we don't know that something is abnormal necessarily unless we start tracking and realizing, oh, this is not my normal pattern, or I do see some cyclicity here and I'd like to talk to someone about that. So I think that's very helpful. And I wanted to chime in with a listener question because this is
Mm-hmm.
the perfect spot. Um, thanks to Sherry for submitting this question. She wanted me to ask you, what do I count as the last day of my period? So, like you said, your period should have a beginning, a middle, and an end. And Sherry said sometimes she has some spotting at the end. So, how do we count the last day of menses?
That's a great question. And I think about how I address this question with clients. And typically, when I'm using either, like many of my clients will use a charting app, or some of them will use, like I have a paper charting workbook. And typically, I mean, I think the official answer would be the day that the flow officially stops. I feel like there's a little bit of giveaway. One thing I often tell my clients is like, we're not going to go in and grade your paper, so to speak. We just do our best to put down what is happening. And so it wouldn't be uncommon if you have a couple of days of a little bit of like trail end bleeding or spotting, like that's kind of at the end of the period. I'm picturing, the little emoji things in the charting app where you have your days of bleeding. The system that I use with clients, it's color coded. So on those days of bleeding, it would be like a red dot, red dot, red dot. And then if we have some spotting, there's actually a little spotting dot. And if you're using paper, you can actually just kind of put that in. And so if that all happens together, then I would say it's a judgment call. If you literally have like you wipe once and there's like a streak, are we going to call that the last day of your period? Maybe not, right? I would just call that the spotting at the end and call it when the faucet turned off, like when the overall, generally the bleeding stopped. So hopefully that is helpful just to kind of note it. I like to focus on the overall picture so we don't get all hung up on the details. One of the challenges with charting and being a charting instructor is that we want to have all of the detail because it really helps us, especially when we're looking beyond simply timing and understanding the fertile window to looking potentially at that link between hormonal health. So especially the method that I teach my clients, it's very detailed. We have a lot of different notations. We have lots of different notations for cervical mucus, and there's lots of different ways we can track things. But we always have to hold that in balance with what we're trying to get out of it. We don't want to go so far into the weeds that we think everything's a problem. Because there's no such thing as a perfect chart. You're a human being. Everything's going to be a little bit different from cycle to cycle. So hopefully that helps. And I also threw in some bonus like chart coaching support.
Yeah. You mentioned, I think when we start collecting this data, there's so much we could track, right? We could
Yeah.
track our bleeding pattern, our cervical mucus, our basal body temperature, our cervical position. I mean, we could really track everything. And for the right personality type, that can become overwhelming, or it can become just like another task and another thing we have to do and should do. And that's the perfect lead into another question I wanted to send your way. So Keisha, thank you for sending this in. Keisha asked, she said, taking my basal body temperature gives me anxiety. Can I still track my cycle accurately? So I'm going to kind of expand upon that and say, do we have to track all of these factors to be successful, or can we pick the ones that feel most approachable for us?
Well, I think first and foremost, like I teach a particular charting system. So I think it's useful when we talk about charting to recognize that there's multiple different fertility awareness based methods under this umbrella. And that's a good thing because there's methods that are mucus only. There's methods that are temperature only. Now I'm a bit biased because I want to encourage everyone's success. So I think the best case scenario is when you actually chart in a certain way and you follow certain rules and you pick which charting system you like and you kind of go by that. So that's kind of the first part of it, because I want to encourage everyone to be successful. But absolutely, you can find the system that works best for you. So the system that I teach can be used without temperature. And it depends on what a person's goals are. It depends on what their outcomes are. So if someone's trying to conceive and they're not using this for birth control, it's a bit of a different strategy you can take. And when you're trying to conceive, I suggest that mucus be the primary sign that you're focused on, because if you're trying to time sex correctly, that's actually what you want to look at first. The temperature is helpful. It allows you to confirm ovulation, but that's after the fact. So it doesn't give you that heads up. So if the questioner, the woman who left the question, if she is actively trying to conceive, then absolutely cervical fluid would be the best way to confirm when she's in her fertile window. And you can actually confirm ovulation with cervical fluid as well. So the way that you do that, to get into a little bit of the technical weeds,
Yes,
is
please.
that you would identify what we call your peak day. So that's the last day that you observe the mucus that's like clear and stretchy. So if someone's charting their cervical fluid for a while, you may notice that there's two general types. So there's the mucus that looks like the clear, stretchy, raw egg whites that you can like stretch between your fingers, or if you don't have such a high quantity, if you go to the washroom, like you'll wipe and it'll be really, really slippery. So the last day that you observe fluid like that is typically highly correlated with ovulation. So even without temperature, you can learn to identify that day and, depending on the system you're following, follow the rules. So in the rules that I teach, you count 3 days after that. And if you really, really did ovulate, your progesterone is going to rise and that's going to suppress further mucus production for the rest of the cycle. So someone who's in the charting weeds, of course, I encourage them to consider working with an instructor who can teach them to make sure that they're following what they need to follow and they understand everything they need to understand and they have the opportunity to ask the questions that they need to ask. But you can do that. And I think when I'm working with clients, I always try to make it as approachable as possible. My goal is always to meet my clients where they're at. So we definitely don't want you doing something that's causing you extra anxiety. We want to look at what your goals are and try to fit this charting into that instead of trying to force ourselves into a box to kind of make it work.
We've got options. So
Yeah.
whatever you feel like is going to be realistic for you, I'd rather, and I'm interested to hear if you agree with this, I'd rather someone collect any signs than feel like I don't like one of them, so I'm not going to do any of it.
Yeah, for sure. And I think the only time that I want to kind of give that extra encouragement is especially for somebody who is using the method for birth control. So I feel like for birth control, we want to make sure that we're dotting our I's and crossing our
Yeah.
T's and that you can still be successful with other methods, but for example, if you are brand new, temperature can be really helpful. It's something that I would say, that could be useful for a period of time until you get your training wheels off, right? And then you can see if it's appropriate to move on. But conception is a little bit different because we're not actively avoiding pregnancy. We still need to understand the rules and everything, but there's a whole lot more give, I guess you could say, in that. So absolutely, I think it's a choose your own adventure. But again, I'm biased. I'm biased because I teach it. And you know what I mean? Like when you
Yeah.
teach it, you kind of like I'm a little bit more like, yes, but we want a little bit of structure, but you can absolutely do without temperature. You just need to know what you're doing because I just want everyone to be successful.
Yes, we want everyone to be successful. And it's interesting to think about in my practice, since everyone's trying to get pregnant, I almost never have the preventing pregnancy
Yes.
conversation because that's just not where my patient population is at. But that's a great point. When we need that added layer of specificity because we're being more careful, that makes great sense.
And one other thing I'll just say,
Yeah.
because when I was first learning about fertility awareness and to teach others, I was really young. I was in my late teens. And so I like in my mind was like, how could you screw this up? Like you're trying to get pregnant. And so the one thing too is that like you can screw it up. So the temperature is like you can figure out how to do this without the temperature, but I would say you still want to, if possible, try to have two signs. So if we're
Mhm.
not doing the temperature, and everyone isn't comfortable with the cervical position, but we're having this conversation. So,
Yep.
for my clients, especially at the beginning stages when we're still figuring out what their cycles are like, what their mucus patterns are like, like we still haven't completely figured it out. There can be times when you look like you're approaching ovulation, you have that great cervical fluid, and then it goes away for a couple days, but then it comes back. So we just want to make sure that when you're in that kind of charting weeds and you're learning to do these things, if you are uncomfortable with temperature, there's a couple of suggestions that I make to my clients. So one is, if taking it is causing you anxiety, like I'm I often promote the temp drop. I don't promote a lot of products, but that is a great option for women who still want to take their temperature, for whom the temperature itself isn't necessarily causing anxiety, but they're just having a hard time like remembering and the practicality of it and putting in the app. So that's something that can be useful for clients, again, depending on the situation. If it's more the like taking it and like having to do it and having to remember it, if that's what's causing you the stress, then wearing this thing that can automatically sync to your phone can be great because then you still rely on the mucus to give you the timing information that you need, but you could have this device take care of the actual temperature so that you could be duly sure that you've ovulated. When you're trying to conceive, it is important to confirm ovulation for a couple of reasons. One, because then it tells you if you really have, like if you can stop trying for that cycle. What can happen sometimes in that month where you're really stressed out and all that kind of stuff is that you could stop trying, but then because you thought you ovulated because you had the mucus and then it stopped for a couple of days, but then the mucus comes back and then you ended up missing out on that whole window, that whole cycle, all because you didn't know. So it's interesting because I want to, like we want to find the best way to be flexible, but I find that sometimes when you're working one-to-one with a client, it is really helpful to have a couple of cycles together so we can see what's going on with them. We can see, does she have a strong mucus sign? Are we able to confirm ovulation easily by watching what's going on with her? Or does she have a kind of a continuous mucus thing going on where it's kind of harder to tell so that we can really customize what's going to be the best approach for her to make sure that what she needs to do is done, but that we're still being accurate with the method.
Yeah, that makes good sense. And I think here maybe it's appropriate to unpack where that stress is coming from. Like you said,
Yeah.
is it that you're unsure that, you have to set your alarm and you have to wake up and that part is stressful? Or is it seeing the actual number that
Yeah.
is stressful? Like, what is the source of that
Or
so that
like
we can work
waiting
through
for
that?
ovulation to happen, or
Yeah.
because for some women, the stress of actually charting it, regardless of which sign we're talking about, that in of itself is too much. So in a situation, and I've had clients like that where they just get so stressed out about the whole process. It just feels way too overwhelming. And so in those situations, it can be helpful to peel it back. So we're only doing like one thing. So it's like mucus only, and for some clients, that would be great. It's like, okay, I just have to focus on this one thing. I'm not going to do anything else. And I feel good. For other clients, they might need to take a break. They might need to just not track anything for a cycle or two to kind of, if they've been trying to conceive for a long time, if it hasn't been happening and this whole process is causing them a lot of stress, it might be worthwhile to actually stop, take a couple of cycles where they can just do what they need to do, whether it's reconnect with their partner or just, go for hikes and just not look at a thermometer. So I really think it's custom depending on where the person is in her journey.
Protect your peace if you need to, right?
Yeah, absolutely.
On the line of situations that could be stressful, let's talk about irregular cycles because I think this comes up quite often. Can we use fertility awareness when our cycles are irregular? How does it change? What's your advice?
That's such a great question because it's so common and it's one of
So
those myths
common.
that like you need to have this perfect 28-day cycle to use fertility awareness or it won't work and it won't be effective for you and all that kind of stuff. So, I mean, I could start by saying, well, what is an irregular cycle? So
Please.
the way that I define, not just me, but even in the literature, when we look at what it really constitutes an irregular cycle, it would be a cycle that varies more than 8 days from cycle to cycle. I just like combine two words from randomly, but 8 days. But yeah, so I think that's helpful because you've probably found this as well, but a lot of women will think that their cycle is irregular if it's 28 days sometimes and 32 days sometimes. And that doesn't fall into the irregular cycle territory at all. So first of all, we want to just recognize that, you're not a robot, you're human. And so some cycle fluctuation is completely normal. And so even if we have, 3, 4, or 5 days difference between one cycle to the next, one cycle it's 27 days, the next cycle it's 32 days, and then the next cycle it's 33 days. And, that's actually within what we would consider to be the normal range. It's when we start getting into those much more significant fluctuations, 35 days, 45 days, 60 days that we're looking at cycle irregularity. So that would be the first thing. Now, fertility awareness in terms of whether you're trying to optimize your chances for conception or whether you're using the method for birth control, it can still be effective in both scenarios. Of course, it does come with some I suppose some different knowledge, different things that you have to do. So if you're actively trying to conceive and you do meet that definition of irregular cycles, given that we started off by talking about this concept of the menstrual cycle as a vital sign, we want to recognize that when you have those discrepancies in the cycle, it's typically related to some sort of underlying factor. So as you had mentioned previously, one of the common reasons for consistent irregular cycles. So not just like having one cycle that's we're not talking about like the one time that your cycle was like 42 days, but the rest of the time it's, still within that normal range. We're talking about consistent cycle over cycle. We're having this long irregular scenario. Polycystic ovary syndrome, PCOS, is a really common factor, common cause, though it's not necessarily the only cause. Thyroid issues can throw off the cycle, gut issues, anything that can cause inflammation. I've had clients that had, severe Crohn's disease and things where this inflammatory condition is contributing to basically interfering with ovulation. When you have a long cycle, what's happening there is that ovulation is delayed. And it can be related, as we talked about, even HA. So I think from that broad standpoint, if you are having irregular cycles, can I say that? That we should be looking deeper into that to see what is going on. From a fertility awareness standpoint, if you're trying to conceive, and let's use the example of PCOS, and actually in our PCOS chapter in Real Food for Fertility, we included a couple of client charts so that you can actually see what that looks like. So we had a chart, I think the one chart was something like 45 to 50 days, and like based on a real chart. And another was 60 days. And we actually included a pregnancy chart from a real client with PCOS who successfully conceived. And I would have to pull it up to see. Now I wish I had the exact, let me see if I can pull it up while I'm talking, and then I can tell you the exact, based on her temperatures, like when she actually conceived in that cycle. But the reason we included it is for a couple of reasons. So when you have a long irregular cycle like that, it just comes with a certain challenge. Like you just have to kind of understand what you're dealing with. So in PCOS, what's really common is for women to have either a lot of days of mucus or multiple patches of mucus. And the reason for that is because in that specific situation, what you have is, polycystic ovary syndrome means that you have polycystic ovaries. So you have an ovary, and if you picture a little bag of marbles or something like that, there's a lot of small follicles that are developing, but because of typically the insulin resistance, the inflammation, all of these things, all these different factors that are associated with this metabolic condition, those things are interfering with ovulation. So you have all these little follicles that just aren't quite making it, like they're not quite there, and they're all kicking out estrogen. So you don't necessarily have high estrogen, but you have like estrogen higher than it's supposed to be for long periods of time. And that can stimulate the cervical crypts to make mucus. So you can have, one of the things that I've seen a lot in PCOS clients is like you have like a little bit of the stretchy stuff all the time. So it's like you don't necessarily have loads of it, but you have like a little bit, but it's like for days, like or weeks, you have like a little bit of this all the time as you kind of approaching ovulation. And other women will have these patches where it looks like they're going to ovulate, and then they go back to not seeing mucus, and they have several days of mucus, and then they go back to not seeing it. So from the practical standpoint, from someone who wants to conceive, it can be frustrating because it means that every time you see these patches of mucus, you probably should try to, probably should time sex, probably should have sex every time you see that clear, stretchy mucus, or at least once every patch type of thing, strategy. And, but you have to always keep in mind that you have to confirm ovulation before you're kind of quote done for the cycle. So that obviously the challenge is that there could be multiple patches, and that can feel frustrating. You don't necessarily know ahead of time which patch is truly going to lead to ovulation. And when your cycles are that long, it can be extremely frustrating. You're on day 42 and all you want is the ovulation to happen. So there's definitely challenges to work through. But from a practical standpoint, if you understand how your cycle works and you understand the role that mucus plays, so we didn't really get into it, but the reason that the mucus is fertile is because when you have this cervical fluid, this fertile quality cervical fluid, it can keep the sperm alive for up to 6 days. It can shuttle the sperm into the reproductive tract. It's also a sign that your cervix is open. And, and if you didn't catch the first part, we're not fertile every day of our cycle. There's this defined window as we approach ovulation. And outside of that window, we can't actually get pregnant. So when we see that mucus, it's also a sign like, hey, this is the time that you're fertile. So a lot of women with PCOS are simply told that they won't be able to get pregnant or all this kind of stuff. But when you have this information, even if your cycles are irregular, you can still figure it out. And so in the example that I was talking about in the book, she followed that strategy, and you can see in her chart, we, we had our wonderful formatters make the charts all pretty, but you can see in the chart, like we put the little hearts where she had sex, and you can see if you take a look that she timed it so that she was having sex at least once or twice every time she had a little patch of mucus. And that resulted in her conceiving in an imperfect, super long cycle where ovulation happened on day like 60 something. And so it doesn't happen like that every time, but it shows you that it's possible. And it also busts some of those myths that pregnancy can't happen. So that was a super long answer, but the short answer would be yes. Even if the cycle is irregular, fertility awareness still applies. It can be frustrating, but I would still argue that it gives you the upper edge of a not so like you're making lemonade with lemons, basically.
I thought that was such a helpful answer because I think a lot of times when we have really long cycles, I hear this from my patients with PCOS all the time, that they're like, whatever's happening in between day one and day one is a mystery to me. And I just give
Yes.
up because I don't know. And so the fact that you're looking for these signs and at least making, like you said, it's a strategy. You're having sex when the chances of conception are highest. And if it doesn't happen this time, we'll keep trying when we see that egg white consistency. And that feels really empowering to me because it's more actionable than just waiting for something to
Mm-hmm.
be clarified.
Well, and even to take it a step further, I mean, we have an extensive PCOS chapter, and Lily wrote like a really solid nutritional approach for PCOS. One of the things that the research often talks about with PCOS is because we have this scenario where we have this inflammation and the glucose issue, up to I think it's 80% of women with PCOS have insulin resistance, like it's really high number. So there's all these other things that are happening that can have a negative impact on egg quality. So it's not to say, I mean, I think that it's great to have both of these things happening at one time. So we are showing you how to time sex accurately, which is great. I mean, because like you said, it's not just like, I don't know what's going on for 60 days. Like that's insane. Like right? Like
Yeah.
that'd be so frustrating to have to, especially when you're, what I term uncontrolled PCOS, like before we have the cycle under control, that's extremely frustrating. But when we can identify that some of these other factors start working towards improving metabolic health, optimizing nutrition, really focusing on the nutrients that we need in order to optimize egg quality and help to reduce the inflammation, help to improve ovulatory function so that we eventually work towards getting the cycles more normalized. So it's not just about dealing with the challenge of the irregular cycle, but it's also about working towards normalizing it, improving egg quality so that you're working on both fronts to optimize your chances of conceiving naturally.
I love it. And I say that about any intervention. Like, whatever we're doing, it's never just that one thing in a silo. It is a comprehensive treatment plan looking at, tracking the cycle and the lifestyle factors and medications if we need them. It's both and. So I think that's very well said. I want to compare and contrast this to a hypothalamic amenorrhea situation in which we would also see potentially very long cycles. But I'm imagining that in that situation, I typically see lower estrogen. So are we going to see a long cycle, but without that continuous mucus, or do these charts look different?
Such a great question. It's so I feel like in the book we argue that they're very different, like they're kind of opposite. Although there's a table that I put together to kind of show like PCOS, HA spectrum, because we're also talking about something I call the HA spectrum. I think that this is a tendency in medicine to it's like you just don't have it or you have the worst possible version of it, right?
Yes.
So it's like you either don't have a thyroid problem or you're like totally full blown hyperthyroid and there's like nothing in the middle. So I think with HA, it's really helpful to talk about it on a continuum. And the reason that I think that that's important is because not every woman who has poor habits around her diet and exercise lose their periods entirely.
Yeah.
So not every woman that kind of is on this road necessarily completely loses her period. And there was a really interesting study where it was a controlled feeding study, and they had two different groups, and they had one group that was eucaloric. So one group that was given sufficient calories in their diet to make up for their, activity level, and they're like measuring it, real specifically. And then there was another group that they had them exercise a little bit, but they specifically gave them somewhere between 20 to 30% lower overall calories than what their body required, as calculated by their detailed methods. And so what was interesting is that in that particular study, the women who were given that lower calorie diet, they did not stop menstruating and ovulating. So the cycles actually were not really that disrupted. But what was really interesting about the study was that they measured hormone levels, and they found that the estrogen and progesterone levels were actually significantly lower, even though they maintained ovulatory function. And so this is to kind of support that concept that I want to share, which is that idea of this HA spectrum, where when you have a woman who is, let's say in that typical HA scenario, so HA again characterized by over exercise, undernutrition, and stress. So meaning like you're just in a calorie deficit situation. The question really is like how deep, how much. So you can get to the point where you start to see ovulatory disruption, where you start to see a delayed ovulation, or you start to see like lower mucus production, because like you said, when you're not consuming enough food in that scenario, then what happens is your body doesn't have enough of those raw materials to actually make those hormones. If you're not getting sufficient overall calories or sufficient protein or sufficient fat, your body literally doesn't have the building materials to actually manufacture these hormones. And so if you are still making enough hormones to ovulate, then when you ovulate, you might notice that the second half of the cycle, the luteal phase, becomes shorter. You start to see spotting. So arguably, there's some similarities between PCOS and HA, because we do have often, depending on what's going on, that kind of delayed ovulation or a bit of cycle irregularity. But unlike PCOS, with PCOS, as I had briefly talked about, you have all these ovaries or all these follicles in the ovary putting out estrogen. So it's not a low estrogenic state. And typically, because if you have this long pre-ovulatory phase, like a delayed ovulation where you're still getting all that estrogen exposure, it's not uncommon for women with PCOS to have spotting mid-cycle, to have anovulatory bleeding, or to have heavy periods. It's quite common for women because of this kind of estrogen dominant scenario. And again, the word estrogen dominant sometimes implies that the estrogen is really high, but it's not necessarily high. It's just that compared to the progesterone in like the same 12 to 14 day on average luteal phase, like if you have 35, 45 days of estrogen before you finally ovulate, it's just imbalanced in terms of the level of exposure. On the flip side with HA, that's not happening. What's happening is that we are depriving our body of nutrition, and so therefore we're not making optimal hormone levels at all. So we can see on the opposite end of that, lighter periods, not really a lot of spotting. And if you actually get to the level where you're not ovulating at all, so the true definition of HA would be then when you have completely stopped ovulating, therefore you're not menstruating because you're not having a period for a period of time that lasts, 3 to 6 months or more. And in that time, because it is a low estrogenic and low progesterone state, you would expect to not really have much of anything going on. Like a woman with full-blown HA, unless she's in recovery, we wouldn't expect to see any mucus. If she's trying to check for mucus, she's going to be dry and dry and dry. But like I said, there is this kind of in-between period. Like if she's been in recovery, she's starting to eat more, she's starting to exercise less. There might be this in-between stage before her first ovulation where she starts to see a little bit of mucus again. But when we're in the kind of full-blown HA territory, it's kind of the opposite. So what I think is really helpful, especially as a practitioner standpoint, is when you have your clients charting, it makes it a lot easier to identify what is really going on here. It makes it a lot more difficult to confuse the two conditions because they're very, very different.
That makes such good sense to me. And I'm just imagining, like you said, we're always doing other things in the background to restore our hormonal function, to restore our metabolic health. And how motivating if you start to implement all these things and you see your chart changing and improving. Like how satisfying is that? So I love this
Absolutely.
awareness.
Mm-hmm. Well, and that's one of the things I find to be very unique about this whole kind of focus on menstrual cycle charting. And it's something I teach in my practitioner program as well, where I'm biased, like I said already. I've been doing this work for so long, so it's hard for me to imagine working with a client without seeing their menstrual cycle chart, and if you do have a client who HA is a tricky one. We took a lot of time and effort to talk about it in such a way, informed by our client work, and I'm sure you found the same thing. It's very challenging because with HA, it's behavioral. We're getting into these habits. We have these ideas, whether it's our desire to not gain weight, or whether it's our desire to, exercise to a certain level. We get into these habits and it's harder to break. And so if you're trying so hard to change these habits and you're eating more and you're exercising less and you're not seeing those results, it can just be so frustrating. If you're charting and you can see a little bit of that progress, it can make it easier, especially, like I said, from the practitioner standpoint or for the client standpoint, to be like, no, we can see progress. It's not perfect yet, but we can actually see that something's happening.
I think all of this underscores why your books are so helpful, and your new book, Real Food for Fertility. It sounds like there's lots of these gems embedded. Maybe this is a loaded question, but I think it's a good final question for you. What are your hopes and dreams for the readers of this book? What do you hope that it will help them to accomplish?
That's such a great question. I think, of course, lots of babies. We'd love to see lots
Yes.
of real food for fertility babies. So I think that's maybe goes without saying, but I said it. I think generally speaking, with all of my work, I really aim to empower women. I think both Lily and I, it's like we want to put the knowledge in women's hands. Women are given a lot of nonsense. We're gaslighted a lot. We have pain with, periods, and we're told that it's in our heads. Have irregular cycles and we're told, oh, it doesn't matter, just go on the pill. So there's a lot of gaslighting that happens and not a lot of explanation. And I've read a lot of studies where they don't even want to tell women the truth about the side effects of the pill because they don't want to dissuade them from using it. And their biggest concern is like, well, what if we tell them and then they get scared of using it? We want to make sure they use it. So there's a lot of not telling us information that we need. And so we want to be the opposite of that. And so we went really extra in terms of the research so that you can actually see it's not about my opinion or Lily's opinion. It's about what the research is saying about these topics so that we can put the information in your hands and then you get to decide what you're going to do. So in terms of what I want for the readers, that's a big piece of it. I want women to feel empowered with knowledge so that they have choices. And of course, I want the women and couples who read the book to have the option and ability to improve their hormone health. Who wants to feel like crap all the time? We want to feel good. And when we're looking at the fertility conversation, we're wanting to become parents. We're wanting to build our families. And it's like I always say, it's not just about having a baby. That baby is going to be needing your attention day and night forever. And so you need to be energized, nourished. You need to have the energy to be there as a mom. I have three. At the time that we're recording this, I have an 11-year-old, 8-year-old, and 19-month-old. And in order for me to be there as a mom, I also have to feel good. I also have to be nourished. I just had a baby. I need to be able to get out of bed and feel good. I can't have low iron and like low all the things right. And who's going to help us to achieve that? Right. So that was a mouthful, but that's my take on it.
I'm so aligned. We're doing preconception care for a healthy and safe pregnancy to bring home healthy babies and then to have freedom in our health to enjoy that family. And I just really respect that. And I want to thank all of our listeners for choosing this podcast and Lisa's podcast as a trusted source of information to get this knowledge. So big thanks to our listeners, to our show's producer, Paola Martini. Thank you for making our podcast dreams come true. And big thank you to you, Lisa, for being here and sharing all of your insights. It's just been a pleasure chatting with you, and congratulations on the new book. I know this is going to be an amazing resource for so many women and couples.
Thank you so much. Thank you for having me and for having this great conversation.
See you next time, everyone. Did you love this episode and want to hear more? Head over to drkaleawattles.com/podcast, where you can find more episodes on all things fertility.